Welcome back. We have talked a lot about the challenges the healthcare industry has faced in terms of recruiting and retaining staff. Well, last month, Genesis Health introduced a new way to match candidates with open positions. It's a monthly event called Walk-In Wednesdays. This week, we spoke with the director of recruitment to see how that event went and when you can attend the next one. And joining us now is Megan Chadwick. Megan, thanks so much for taking the time today.
Yeah, absolutely. Happy to be here.
Megan, much of your world at this point is recruitment, I assume, based on your title. Um,
Correct.
Talk to me a little bit about one of these recruitment efforts that you guys have really already begun.
So, Walk In Wednesday is something that we created. It's kind of what the name is what it is. It's a Walk In Wednesday recruitment event that we've created to really make the recruitment experience expedited and help the candidate as well as us as a job seeker really find the best fit in a way that alleviates some of the back and forth that's done traditionally through the interview process.
Give us a sense, because you've already done one of these, and we're going to talk about how that one went
Yep.
in just a second, but give us a sense of what someone can expect when they literally walk in.
Really, they walk in, they will meet with someone on the Genesis recruitment team, and they should bring a resume. We want them to be prepared so that they can speak to their work history and share that. But the intention is that they would meet with the HR team to review their work history, to talk about what their interest is, and then we like to couple it with an interview with our hiring leader. So we've tried to get those leaders to be on site as well. As you can imagine, some of these leaders are working leaders and they may have to be up in the unit, but we've really worked with them to plan ahead so that they can be present. They may be in person or they may be available for a phone call. In the instance that they're not available for either, we will then get their cards and coordinate a follow up. But our true vision for this is to really get it all done in the same time, same place. So the interview with HR, the interview with the hiring leader. If it's a good experience all around, they could get an offer in real time that same day. Typically, when you think about the hiring process, you would connect with human resources. Maybe then the next day you would meet with the hiring leader. Sometimes it could even be within a span of a week because of schedules and competing priorities. So we're really, again, trying to make it so that experience can happen all one time, one place.
And this is for all kinds of positions, right?
It is, yes, clinical and non-clinical. I think there's a perception generally in healthcare that you have to be clinical to work in healthcare, and that's definitely not the case. While nurses, physicians are vital to the functioning of our facilities, we have a lot of non-clinical opportunities as well, or even clinical that may not require experience or a certification, such as pharmacy techs or sterile processing techs. And then we also have front office positions, registrar. We really wanted this experience to be for all avenues. So whether you're someone that has experience and knows what you're looking for, but looking for a change, or you're someone that's just seeking to explore a field in healthcare, we want to talk to all of them. We want to find an opportunity to fit what the need is for everyone in the community.
And you guys held one of these already, the first one. How did that go? Was that well attended?
It was surprisingly well. So we actually still had 57 people between our two campuses that attended, and we ended up getting 12 offers out of it. So it went extremely well.
Let's talk a little bit more generally about
Sure.
how this fits into the general recruitment process and really how that maybe is having to be thought of and looked at differently because we've reported a lot on the challenges in healthcare in general. Uh,
Sure.
how are these two things sort of trying to kind of fit together now to fill some important roles, obviously?
Yeah. So I think at the end of the day, gone are the days that people go directly to your website or your applicant tracking system and apply. Typically, they are using other resources like Indeed or other vendors. They also, too, are getting inundated with recruitment opportunities in all avenues. So think about today and the conversation we're having. You're hearing it on TV. You're also hearing it on the radio. You're seeing it on your social media. And so what we did with this event is really tried to hit all avenues because we pushed it out on social media. We sent out email invites. We then allowed people to apply in advance to our applicant tracking system. We're really trying to marry all of the resources that we have. So we're really capturing every opportunity, but also making it extremely easy for the candidate to apply because this market right now is extremely competitive. I mean, healthcare right now, from a clinical perspective, you're not only competing with other healthcare organizations, but you're competing with travel agencies. And then we have, like I said, the non-clinical area that you're really honestly competing with everyone because those positions don't necessarily require a license or a certification. It could be someone that's at the bank, it could be someone that's at your local grocery store. So we're just really having to channel all avenues. And I think the thing that I like most about this event is that it allows the convenience, it allows that walk-in opportunity, but it also really humanizes the experience again. So if you think about the pandemic, a lot of what we had to do became virtual and it became, non-high touch. And we really wanted to find something that allowed us to do both. And that's really what Walk In Wednesday has been able to accomplish at this point.
Obviously, you have another one coming up soon. Can you tell us just the details on that and then anything else folks may need to know if they hear this
Yeah.
and are interested?
Absolutely. So it is the last Wednesday of each month. So our next one will be held on Wednesday, March 29th. It is held at our two primary campuses on the Iowa and Illinois side. So our East Campus location on Rushholme and our Silvis campus location on Illinois Drive, I believe. And it is from 3 to 6 p.m.
Very nice, Megan Chadwick with Genesis. Thanks so much for taking the time this week.
Thank you for having us.
And when